everyone, this is Marika and I welcome you all to this new session of nursing management. In our previous two sessions, we have been discussing about the organization and function of a hospital, wherein we have seen different departments within the hospital and what is the role of a nurse in each of the department. We have discussed about the reception, we discussed about the inpatient department, the outpatient department, the administrative department, and also about the nursing department. Now in this session today we are going to continue the same, wherein we are going to discuss about other departments within the hospital. First department that we are going to discuss is CSSD, which is the Central Sterile and Supply Department. From the term itself, we can understand that this is the department that is responsible for providing the sterile equipments all over the hospital. So within the hospital, we use sterile equipments in order to perform any kind of procedure. CSSD is one of the most important department within the hospital, and the major responsibility of the CSSD department is to ensure that the sterile equipments reach out to each and every ward, each and every department within the hospital wherever it is required. Let us now see what are the functions carried out by Central Sterile and Supply Department. The very first function of CSSD is maintaining incoming stock and registers. In the Central Sterile Supply Department, various equipments are brought in order to sterile those equipments. So they have to ensure that they maintain a proper register and they maintain a proper incoming stock of the articles that are received within the department. The second important function of CSSD is to ensure that they separate the trays, the articles, the linens that are to be provided to each of the department. They receive from various departments. They sterile those equipments, articles and linens. They also have to ensure that it is sterile and then it is well packed in order to give it back to the respective department. The next department that we have is the diagnostic department. So from the term itself, again, we can understand a diagnostic department is a department that carries out various diagnostic procedures for the patient in order to understand the current illness of the patient. The diagnostic department has various labs wherein the tests are conducted, and it has a chief laboratory assistant who collects the diagnostic kits, performs the diagnostic procedure and also gives back the results. Sometimes, if needed, the laboratory assistant also reaches out to the ward and goes to the patient's bedside to collect the specimen whenever it is required, and also ensures that after the diagnostic procedures are performed, the result reaches out to the specific department. So, in certain cases, the patient might not be able to get up from their bed and come to a diagnostic area, come to the lab in order to have a diagnostic test. Therefore, in such cases, the laboratory assistant comes to the ward, comes to the bedside of the patient, collects the specimen, takes it to the laboratory, performs the procedure, performs the diagnostic test, and also ensures that the results reaches back to the particular ward. The diagnostic department has various divisions. As we know, a diagnostic department will have several different divisions wherein different procedures are carried out. They have different lab for conducting microbiological examination. They have different division for conducting X-rays, MRIs, CT scan, etc. The next important department that we have is Biomedical Engineering Department. I think not many of us are aware about this department, but we have a special department and also can be considered as one of the important department, which is Biomedical Engineering Department. What does this department do and why don't we hear about them often? The Biomedical Engineering Departments are a group of people who are recruited in order to ensure the smooth functioning of the articles and equipments used within the ward. So as we know, various different machines, various equipments are required within the hospital for performing every different procedure. Different equipments, different articles are required. Since it is a machine, there is obviously a chance that the machine may not work out for a long period of time, or there can be many technical errors within the machine. It is the responsibility of the biomedical engineers to ensure that they repair those machines and they see that the machines and the equipments used in the ward are functioning properly. The next department that we have is the dietary department. Again, from the term itself, we can understand it is a department that is concerned with the diet of the patient. The dietary department takes the responsibility of providing the right kind of diet to all the patients within the hospital. In the dietary department of the hospital as well, we have a head who looks after the entire dietary department, and he or she is known as the dietitian in chief. We have a dietary department. As the term suggests, the dietary department takes the responsibility of providing the right kind of diet to the patient according to the health needs of the patient. It is headed by dietitian in chief within the hospital. The dietitian in chief coordinates with the health team members and finds out the need of the patient and therefore designs a diet plan according to the health need of the patient. The dietitian in chief is not only responsible for providing a clean, hygienic food to the patients in the hospital, but he or she must coordinate with the healthcare teams, understand the health needs of the patient, and plan a diet according to the requirement of the patient. The next department in the hospital is the canteen department or the canteen facility of the hospital. Canteen facilities or canteen department is constructed within the hospital for the visitors and the family members of the patient. As we just discussed about the dietary department, we have discussed that dietary department provides the required right amount and the right kind of food to the patient. But with the patient, there will be family members looking after the patient. There will be visitors. For those visitors and family members, every hospital will have a canteen facility so that family members who stay within the hospital during the time of patient's hospital stay can utilize those facilities. The next important department that we have is emergency or casualty department. Now, we are already aware that emergency or casualty department is a department that is open for 24 hours, and the patient in emergency health needs can reach out to the hospital in emergency department. Casualty or emergency department is the only department in the hospital that functions 24 hours. Emergency department is a well-equipped department with the staffs, the beds, the machineries and articles required in order to provide any kind of emergency care to the people. In the emergency department, another important thing that is always available is the ambulance. In the emergency and casualty department, as I told, it is 24 hours open, so therefore there is a strong team that is required in order to operate the emergency department. Therefore, we always see an emergency doctor, staff nurse, ward boys, etc. I hope you've understood about emergency department. The next that we have is operation theatre. We already are aware that operation theatre is one of the major departments in the hospital, and it is a place where any kind of surgery, whether it is a minor surgery or a major surgery, is conducted for the patient. In operation theatre, the visitors are restricted. The nursing in charge looks after the operation theatre, wherein she coordinates with the doctors, the surgeons. She plans the operation schedule for the patient and makes the operation theatre ready for performing any kind of surgery. The next one that we have is the specialized department. Now, as again the term suggests, specialized departments are the departments that provide specialized care for the patient with a specific health needs. It includes ICUs, neonatal ICU, medical ICU, etc. In the specialized department, the patients with serious conditions are treated with the use of special equipments such as ventilator, defibrillator, suction apparatus, etc. In the specialized department as well, similar to the operation theatre, the visitors are restricted. The nurses that are allotted in specialized department are a well-trained nurse who are expert in providing care to the people with serious illnesses. The function of the ICU nurses or the specialized department nurses is not just providing the care to the patient but also maintenance of various registers within the department. The next department that we have is biomedical waste management department. We are already aware that a biomedical waste department is a department that takes care of disposing the waste materials that has been produced in the hospital. So within the hospital, different kind of waste is generated, from plastic equipments to glass to organs to blood. All of this is what is produced in the hospital. So biomedical waste department is one of the most important department, as they take care to dispose the waste that has been produced in the hospital. Members of the biomedical waste department coordinates with the nurse in charge, who makes sure that the waste is disposed appropriately. The next unit of the hospital is the isolation department or the isolation unit. Isolation units are also one of the important department of the hospital, because there are so many illnesses for which the patient has to be separated. Isolation units are required in order to isolate the patient from other patient within the hospital, to ensure that the disease is not passed on to the other people as well as to the medical staffs within the hospital. As it is isolation unit, we should understand that isolation units are constructed slightly away from the hospitals. The patients with various communicable diseases such as leprosy, tuberculosis, HIV are admitted in isolation units. We are already aware about isolation units, wherein we ourselves have seen during the time of COVID-19 pandemic that isolation units are very important. When we know that a certain illness can be communicable, when a certain illness can be passed from one person to another, such kind of patients must be separated from other people around. During the time of COVID-19, the patients were admitted in a separate ward, wherein they were isolated from all the other patients within the hospital, to ensure that the illness does not spread further within the hospital. As I've told, isolation units are constructed slightly away from the main building of the hospital. There are patients with certain illnesses such as tuberculosis, HIV, leprosy, COVID-19, etc. But what about the medical staffs? The medical staffs have to provide care to the patient even though they suffer from a communicable disease. The isolation nurse in charge and the infection control nurse in charge ensures that proper barrier techniques are followed by the nurses when they go to provide care to the patients who are isolated. The next department that we have is the post-mortem room or autopsy room. Now in this department, the dead bodies are brought into the post-mortem room, wherein the investigations are performed in order to find the cause of the death of the patient. The post-mortem report is evaluated by the chief medical officer and it is conducted by pathologist. As I said, the chief medical officer will evaluate the post-mortem report, whereas certain pathologists, the doctors who are experts in identifying the cause and nature of the disease, performs the autopsy. The staffs who are involved in conducting the post-mortem also coordinates with the forensic department to find out any problematic cause for the death of the patient. And finally, after the post-mortem is conducted, the dead body is stored in the cold chamber until the family members come and claim for the body. A death certificate is issued for the patient after a complete examination is done by the post-mortem team. The next department that we have within the hospital is a forensic department. The forensic department is a department that investigates a certain case, for example, a medico-legal case, or they also coordinate with the autopsy department to find out any kind of problematic cause for the death of the patient. In the forensic department, we have a specialized forensic medical doctor and also a forensic staff nurse who assists the doctor in finding out the cause of the death of the patient as well as investigating various causes of the death. Another department within the hospital that we have is pharmacy. Now, pharmacy is also one of the most important wing within the hospital, and we know already that a pharmacy is a department that provides all the necessary medicines and articles required to perform any kind of procedure for the patient. Pharmacies within the hospital is also one such department which is open for 24 hours, and it coordinates with the patient, with the family members of the patient, in order to provide the required medicine and articles for the patient. The next important department that we have is a physiotherapy department. A physiotherapy department provides the physiotherapeutic treatment for the patient and usually Post-operative patients are given physiotherapy treatment in order to ensure that they reach their pre-disease functioning. The next department is the research department. Now, when we discussed hospital, when we discussed the objectives and scope itself, we've seen that research is one of the most important objective of the hospital. Hospital staffs, medical professions are actually encouraged to get involved in the researches of their respective department in order to enhance their knowledge, in order to provide evidence-based care to the patient. So research department is found in each and every hospital, and it conducts researches on various topics and also aims to provide evidence-based care to the patient according to the result that has been generated after conducting the research. Every hospital has a research ethical review committee who validates the research that are conducted by various medical professionals, and it also ensures the safety of the patients. The next department that we have within the hospital is a counseling department. Counseling department is also one of the important department within the hospital, wherein various counseling is provided for the patient in need of any kind of support. We already are aware what is counseling. Counseling is a process wherein two people interact with one another. Out of two people, one is the counselor who is a trained professional, and there is a counselee. The counselee needs external help. The counselee has a certain problem, is not able to cope up with the problem he or she is facing, and therefore requires the external help, and that help is provided by the counselor. Now, counselor, as I said, is a trained, educated person who helps the counselee to clarify, to understand what exactly is the cause of problem, what can be the possible solution, and also helps the counselee to take a correct decision according to the need of the client. Counseling is not just provided for any kind of mental disorder or for people suffering from any kind of mental issues. The counselor provides counseling to the counselee according to the need of the counselee. It may be related to a physical disease such as HIV, or it may be for family planning and genetic counseling. Now, who are involved as the team members in the counseling department? Obviously, we have a psychiatrist, a sociologist, and a specialized nurse in order to provide counseling to the patient within the hospital. A psychiatrist, as we know, is a trained professional in mental health, and then we also have a psychologist who is specialized in guidance and counseling, and also a nurse who work together in order to provide right counseling to the patient according to the need of the patient. The next department that we are going to discuss is also one of the most important department within the hospital, but it is not a medical profession seen within the hospital. That is housekeeping department. We already know that a housekeeping department looks after the sanitation, cleanliness within the hospital, and there are various people who are involved in the housekeeping department. In the housekeeping department as well, there is a head who coordinates the work among its team members and is called as the housekeeping in charge. The housekeeping in charge takes the responsibility of the safety and security of the patient while they are hospitalized. The housekeeping in charge makes frequent rounds within the hospital to see the sanitation, to see the cleanliness within the hospital, supervises the works of the sweepers and the attendants to ensure that the hospital is cleaned properly. Within the hospital, there are various departments that are to be cleaned. The washrooms in the hospital, which is used by the patient, the wards within the hospital, and so many departments are available within the hospital. Therefore, the housekeeping in charge must be very alert, must delegate the work properly to its team member, and also supervise the work of the sweepers and the attendant. The next department that we are going to discuss is also not a medical department, but also one of the important department within the hospital. The department is the laundry department. We know within the hospital several linens are used by patient. For every different patient, the linens are to be changed. Therefore, laundry department has a continuous work to perform. In the laundry department, all the unclean linens and the dresses are sent so that it can be washed, cleaned, and given back to the respective department. The laundry department also has to maintain the incoming as well as outgoing register. So for a particular hospital, there will be one laundry department. In the laundry department, various clothes, various linens will be received from all the departments within the hospital. Therefore, it is necessary to maintain the incoming as well as outgoing register to ensure that the department receive the required linens and clothes on time. The next department that we have is rehabilitation department or the rehabilitation center. We are already aware that a rehabilitation center or a department is a place which helps the people to restore their pre-disease functioning. So in the rehabilitation center, patient with physical illnesses, physical disabilities, patient with mental illnesses, mentally retarded people, physically handicapped people are given assistance, they are provided care with so that they are able to maximize their capabilities to live. A rehabilitation center or the department is a department where we provide care to the people suffering from certain illnesses so that we help them reach their pre-disease functioning and that they can use the potential to the maximum again. For example, the patients of mental retardation or patient with other mental disorder after they have taken the treatment are provided with vocational training. Those kind of patients are taught and trained on how they can make their living. For such kind of patients, simple activities such as basket making, candle making, etc. are taught so that they can earn their own livelihood. And finally, we have nursing stations within the hospital. Nursing stations are present in each of the ward where the nurses stays and supervise the work within the hospital. Nursing station is located in each and every ward for the nurses working within the ward so that they can stay within the ward and supervise the work inside the ward. In the nursing station maintains the case sheet of the patient and maintains the registers required within the ward. Along with the nursing station, for the nurses, there is also a nursing rest house where the nurses can have food and take rest. These are the major departments that we see in the hospital. I hope you've got a clear idea about how a hospital functions and what are the different important departments within the hospital. Along with all the departments that we have discussed in detail about, we have other departments in the hospital as well, which includes the blood bank. So when we go to any hospital, we see that there is a blood bank in the hospital for the patient in need during the time of blood transfusion. The second department that we see in the hospital is a pediatric OPD. Every hospital will have a separate wing within the hospital for pediatric, and that is called as pediatric OPD. The third one that we have is immunization clinic, and the immunization clinic is a place where immunization is given. Other important departments also includes the ENT OPD, the eye OPD, the cardiac labs. We also have bronchoscopic lab, family planning OPD, medical OPD, sample collection center, orthopedic OPD, obstetric and gynecological OPD, the X-ray department, neurology department, psychiatric department, the dermatology department, and the chemotherapy department. So along with all the important departments that we discussed in detail, these are other several departments that are located in the hospital and is also an important part of the hospital. So this brings us to the end of organization and function of the hospital, wherein we have discussed in detail about how a hospital functions, what are the different departments that are found within the hospital, and we have also discussed about the different functions of the nurse in each of the department. We have discussed in detail about the reception, the inpatient, the outpatient department, the administrative department, the nursing department, and other departments such as CSSD, the laundry department, the housekeeping department, blood banks, the rehabilitation department or the rehabilitation center, physiotherapy department, dietary department, biomedical department, operation theater, and several other departments. I hope the class was helpful and I'll see you all in the next session. Thank you and have a great day ahead.